In comes an 84-year-old female patient referred to outpatient physical therapy with complaints of bilateral shoulder pain and presents with severe kyphosis. Ready? Hi, my name's Mosin. I'm a student of physical therapy. I'll be working with you today.
Nice to meet you.
All right, nice to meet you as well. So, what brings you in? I hear you have pain in both shoulders.
Yeah, so the past few months I've had pain in both my shoulders.
Okay, what's it been limiting you from, like, in your day-to-day life? What usually hurts?
Definitely overhead motion, so reaching, stuff like that.
Okay. What's your housing situation like? Do you live on your own, with people?
I live alone, but my son does help me. So.
Okay, great. All right. Okay, so when it hurts, how much out of 10 would you say it hurts at rest versus with movement?
At rest, I'd probably say about a 5 out of 10, and then with movement, I'd say an 8 out of 10.
Okay.
So very painful.
Gotcha. And then would you describe it as a sharp ache or a dull ache? How would you?
I'd say it's like a constant dull ache.
Okay. And time of day, is it worse in the morning, after activity, like when?
In the morning, at night, and after activity.
Got it. Okay. And anything that you do that you notice makes it feel better?
Heat helps, and when I take like hot showers.
Okay. Nice. What would you say makes it worse usually? The pain.
On days when I have to wash my hair, it's like the motion. And then, yeah, usually just washing and styling my hair.
Yeah, like combing, bringing your arms up and stuff. Okay.
Mm-hmm.
And have you tried using ice or anything?
Yeah, no, I hate ice.
Ice. No go?
Can't do it.
Gotcha. So are you on any medications or anything to like alleviate the pain?
I take Tylenol and aspirin only just to help with the pain sometimes.
Have you taken any x-rays or anything?
Yeah, I have them on my phone. I can pull them up here.
Great.
All right, so right now we're looking at normal or non-arthritic shoulder x-rays. Here we have the anterior posterior view. As you can see, there's good joint space, there's no sclerosis, and no osteophytes. For the axillary view, that's going to be, the ray is going to be shooting from your armpit to medial superior. And as well as here, where you have good joint space, normal concavity of the glenoid fossa, and no posterior wear or malalignment. All right, for Betty's x-rays, we're looking at the AP and axillary view as well. For the AP view, you can really see the osteophytes on the inferior humeral head right there. More joint space narrowing than the image we just saw, and there's sclerosis throughout the whole glenoid fossa and the humeral head. For the axillary view, you can see most of the same, but you can really see the posterior humerus. And there's also a wider concavity of the humeral head due to the osteophytes. All right, so here we have the scapular wide view. This was the last view that was done for Betty in her imaging. So we have the normal and Betty's. So for the normal scapular wide view, you can see that the acromion process is flat. This would be a type 1. For Betty, she's a type 3, so a hooked acromion. So this would explain her positive for the Neer and the Hawkins test, as this will be impinging on her supraspinatus tendon due to a lack of subacromial space. That's going to impinge on her cervicromial bursa as well as the tendon and really hurt her abduction. It's also going to get worse in addition to her osteoarthritis. All right, so based on the scapular wide view and the last AP and axillary reviews, the medical team gave Betty the diagnosis of grade 4 osteoarthritis as well as a hooked acromion that is causing subacromial impingement.
All right, Betty, so first, really quick, we're just gonna take some vitals just to make sure we're cleared to exercise and do all the tests that we're gonna do today. So if you wanna just give me that arm. All right, so your vitals are all normal. Now I'm just gonna check your sensation in the area to make sure we don't have anything nervous going on.
Okay.
So I'm just gonna tap in areas and you're just gonna tell me if it feels the same on both sides. Ready? So now we're just gonna do a couple strength tests. So first, what I'm gonna have you do is try to go like this with your arms, and I'm just gonna press down. So ready, push up into my hands. Good. Now what I want you to do is try to pull your hands towards your face and pull against you. Ready, go. Good. Now what I want you to do is try to curl your fingers in like you're gonna make a fist, and I'm just gonna pull against you. Straighten them out. Once you try to curl them in, go. Good. Now I just want you to try to spread your fingers apart. We're just gonna do a couple different tests to see anything else you might have going on in there. So first, what I'm gonna have you do is just relax this arm and just let me go through the motions. And I just want you to tell me if it starts to hurt anywhere. Already? Okay. Same thing on this side. Just tell me when it starts to hurt. Right there. Okay. All right, next thing. Same thing. Just tell me when it starts to hurt. Right there. On this side. Just tell me when it starts to hurt. Right there. Okay.
So here are her results. As we can see, there's definitely a decrease in range of motion in almost all directions of shoulder movement, as well as decreased strength in shoulder and surrounding musculature, which indicates a need for a treatment plan to increase range of motion and strength in those areas. And as we saw, she did have pain with these movements, so we will work on reducing pain.
All right, so Betty, based on the imaging that we saw, it points to arthritis, like bone to bone, and then based on our special test, we can interpret that you're dealing with some sort of shoulder impingement on both shoulders. So we're going to develop a treatment plan to help you alleviate that pain and get back to your normal functional daily activities, all right?
All right, so through weeks 1 and 2, we're just going to improve mobility, pain modulation, and initiate gentle activation of the muscles. So I started off with a moist heat pack to warm up the tissues, followed by soft tissue mobs and some passive range of motion to work on mobility there. I then went on to do some active assisted range of motion exercise for her. Some pendulum swings as well. Then we moved on to some isometric contraction and external rotation and internal rotation of the shoulder, just increasing activation of those muscles as well as strengthening it. After that, we did some scapular retractions, kind of squeezing those shoulder blades together. So going on to weeks 3 and 4, we focused on strengthening scapular stabilizers, enhancing posture, and increasing active control of the muscles. So we did some ERs and IRs banded to help strengthen the rotator cuff. We then followed that with some banded rows, strengthening those muscles as well. Shoulder extensions, another great exercise. We then worked on some more mobility by doing some wall crawls. She could only get half range for now, but that's expected as we work on it more and more. We then also included some thoracic extension, as we know she has severe kyphotic posture, so this will hopefully kind of just extend the thoracic aspect of the spine here and kind of get it into extension. And then some prayer stretch to stretch out, loosen up all those muscles to top it off with weeks 3 and 4 exercises. As we approach weeks 5 through 6, we're going to work on improving dynamic shoulder strength, endurance, and overhead control. We start off with some banded bilateral external rotations over a half foam roller, strengthening exercises, as well as horizontal abductions here. We then did some serratus punches to work on her serratus anterior. As we know on the muscle test, she scored low on that as well, cueing her for proper movement of this exercise as well. Then we did some lat pull downs, which I really love because it's going to kind of force that shoulder into flexion here through resistance. We're working that up and down movement here, and I'm cueing to make sure her shoulder blades are engaged and firing properly here. And to finish off, we did some strengthening for shoulder flexion with some light dumbbells, as well as shoulder scaption. This is to work different planes of motion for her shoulders, because it's going to translate well into her functional daily activities such as brushing her hair and whatnot. And after this, we just ended off with some basic patient education.
All right, Betty, great work today. I just want to go over a few things to take home with you. So first things first, I want you to avoid too many of the repetitive overhead movements. I want you to kind of stay away from that until we strengthen what we need to strengthen and then slowly kind of progress back into it. For sleep position, I want you to make sure that when you sleep, sleep in a comfortable position and make sure that your involved side is like under the pillow to keep it more supported, right? Okay. Aside from that, I also want posture in general to be pretty good. So try your best to avoid that rounding your shoulders. Try to always make sure you're working by keeping your chest out, keep your shoulders down and relaxed and all that. And then finally, use heat as needed for pain, okay? Betty, great working with you, all right?
Thank
we'll
you.
see you next time, all right?
Thank you.